Question 4, the Honourable Ayesha Verrall. Dr. Ayesha Verrall.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks, what were the departmental resourcing and clinical capacity factors that Health New Zealand said led to delays in assessment of Daniel Walker's cancerous lump on his testis, and what, if anything, was being done to address these factors at the time of Mr. Walker's referral to Nelson Hospital's urology service in June 2024?
Before I call the Minister, the answers to this question will be heard in silence.
Mr. Speaker.
The Honourable Simeon Brown.
Mr. Speaker, this case is deeply regrettable, and I acknowledge the significant distress it has caused Mr. Walker and his family. I'm advised that the delay in treatment resulted from a combination of factors. Initially, the referral was triaged as urgent, but a human coding error led to it being downgraded, causing the delay. I'm also advised that Health New Zealand is investigating this incident to prevent this error from happening again. Additionally, I'm advised that Health New Zealand has identified that operational pressures in the system played a role in this situation because of the unexpected extended absence of a key clinician. As this case is currently before the Health and Disability Commissioner, it would be inappropriate for me to comment further on the specifics.
Is it correct that Nelson Hospital was trying to source a locum urologist in June 2024 when Mr. Walker was referred, and if so, had approval been given for the vacancy to be recruited into?
Well, Mr. Speaker, that's a specific question. I invite the member to put that in writing, and I'll come back to her in regards to the specifics of that question.
Why did Health New Zealand, in its response to Mr. Walker's ACC claim, say that the delay was due to resourcing factors if they are now saying that it is due to an administrative error?
Well, Mr. Speaker, I repeat what I said in my primary answer, which was there was two particular factors at play here. The first was a human coding error. The second was an operational pressure in relation to the unexpected extended absence of a key clinician. So there were two factors. As I also said, Health New Zealand is investigating this incident to prevent this error from happening again, and it is also before the Health and Disability Commissioner as well.
How can the administrative error be involved in the delay when the fact is that it was on July 19th that the recoding of Mr. Walker's clinical condition occurred, when he was already beyond the limit for the clinically acceptable time for his condition to be seen by a specialist?
Well, Mr. Speaker, as I said in my primary answer, the case is deeply regrettable, and I'm advised the delay, one of the reasons for the delay was the fact that the referral was triaged as urgent, but then a human coding error led to it being downgraded, and of course that took time until that was then noticed. That is deeply regrettable, and I acknowledge that that is why I've also been advised that Health New Zealand is investigating this incident to prevent this error from happening again, and there are investigations also underway by the Health and Disability Commissioner.
Is it correct that while Mr. Walker's cancer care was delayed for lack of a surgeon, and the lump in his testis grew and spread, the government removed the power for Nelson Hospital to approve its own recruitment?
Sorry, can you repeat that question, please?
Is it correct that while Mr. Walker's cancer care was delayed for lack of a surgeon, the lump on his testis grew and spread, and the government removed the power for Nelson Hospital staff to approve recruitment?
Well, Mr. Speaker, what I would say is that the situation is deeply regrettable, and the delays did cause significant impact on Mr. Walker, and that is something why there is now an investigation underway by Health New Zealand into this incident.